Hello everyone, welcome back to my YouTube video channel again. I want to show you this case that I started, and I want you guys to follow up with me the next few weeks to see how this one gonna turn out. And so let me just go back one more picture before we jump into this. Yeah, let's see if I can go back. Okay, just want to start it again here. Sorry about that. So here's my video. Um, here's the case. This is the patient presented to her smile. As you can see, tooth number 8 and 9 are not really symmetry. Number 8 seems to be smaller. At the dentist trying to touch up with some composite here, but it's always been not even. She have a number recession number 9 and number 11 and the brush like that. This is the same picture, but you can see more on detail like the recession. If you measure the length of number 8 and 9, they are not even. It seems to me like this one, number 9, is a little bit longer. Now, if you measure from the cervical marginal come to here, that's a few millimeter, 2-3 millimeter longer. So what do? We my goal for her is we going to give her a new brush that initially I want to start from number 7 to number 11 or even number 6, but economically the patient want to do something minimally expand. So I recommend her to do number 8, 9, 10, 11, redo those. My goal is to give even crown in number 8 and 9. Also keep an even shape of number 7 and 10. Also, my goal is to replace the dark spot here with porcelain and trying to do a gum gingivectomy here with laser to even out the area so that the patient have more even smile. So here's the occlusal view. As you can see that the brush was from number 9 to number 11, and there is a composite filling on number 8 there. Ideally, the color from here to here, they need to be matched together in order to give the best color looking. But in reality, patient cannot afford. So want to simplify this, so I went ahead and do that. So the next one is, the picture, as you can see here, is more clearly that there is an issue with the possible recurrent decay right here, and right here, this number 9 and 11. And so just want to show this picture. I want to go back to, I can show you a video of the YouTube channel that how I start this case. All right. So here is the video before we start the cutting the brush off. Now, cutting this brush off is not fun, especially if the marrow is strong. So we're going to remove this brush and re-prep this brush and then re-prep onto number 8, make it more even. Again, every 6 months or year you have to do something. I mean, every 10 years or something. Sometimes the brush needs to be replaced. Now, this is the laser gingivectomy that on number 8, we're trying to accomplish the same length of number 8 and 9. So when the patient get to restoration, they're all even. So this is excited. And I want you to follow up with me so we can see you guys next time and see the result out when I deliver the case, see if you like it. the result will be posted again. Hope to see you guys next time. Here's the rest of the video. So we will prep it, make sure that the laser been cleaned up with debris of the soft tissue. So having porcelain teeth, sometimes they're wearing the incisor X right here. That's another problem is, people don't realize that if you young and you have braces, a lot of those grinding problems here can be prevented. So it's better for you to get braces when you were young. Otherwise, it costs a lot more money to fix with artificial teeth, you guys. Thank you for watching. I want to see you guys another video so I can replace this bridge here in the crown. Thank you guys. Have a great day. Bye-bye.